Let's get it!
Broadcasting to you from a little grass shack in the middle of the Pacific.
Live in the place to be.
Well, they're actually in the Bay Area.
Yeah!
But they are the premier Pacifica show that shines a spotlight on positive Pacific Islanders.
You listening to the sound.
Role models coming brown every Thursday night at 6.
East to west, we getting hurt.
Brought to you by Pacifica by Design. It's the iconic FICA podcast with your hosts, Naki and Carl.
What's up, Naki?
Oh my God.
We made it.
God.
Oh boy. A little bit late, but lucky we're even doing a show. We had a little bit of
Technical
a catastrophe.
Yeah.
Well, some call it
We was
technical
about to throw
difficulty.
This shit out the window.
Oh my gosh. It's the craziest thing. So real quick, get the business out of the way. Season 8, episode 30 of the FICA podcast. So we used to come in the studio pretty often. Lately, because we're so busy, we come in to do the show. And when we leave, we put our headphones down
and walk out
the door. And then hopefully we lock the door. That is the extent of us shutting things. We turn off the lights. We turn off the lights. That's it. We come back in today, and thank goodness for our producer, Nainoa. He does what we always think is just a formality. Let's do sound check. Sound check leads to ripping cables out, many curse words. Why doesn't this mic work? Why doesn't that mic work? And here we are. We made it. We're here.
Here we are.
So today, luckily, and before we'll talk about in my check-in, I'll talk about what happened before Nino and I got in the studio today. But we obviously have our check-ins, we have community announcements, and then we have our good friends at San Francisco Hep B Free, one of the programs that we follow, we believe in, and we see all over the place.
Yes.
We see at different events, and it's awesome to see the reach.
They're everywhere.
And the scope that they've grown to. And that's our show for today. Naki, what's good?
Oh my gosh, busy week. Busy, crazy, fucked up week.
I was going to drop that, but yes, 100%.
Fucked up week. I just can't because I can't hear.
What?
So yeah, tons of stuff happened this week. On Friday, was it Friday? Friday, I went to Nelani, our great niece. She had a volleyball game. Southern Utah came to Santa Clara University. And Mo and I went. And Santa Clara University it's so nice.
Oh, it's in Santa Clara.
Oh my God. It's like I think it's a private university.
There's a lot of money there.
It is bougie. Like it's like went to
it's I don't know. I'm sure the listeners can help. So I thought it used to be a UC,
right.
University of California, Santa Clara. It sure seems more like a private college now.
Yeah. We drove in to the college and we ran into 3 students and we're like, hey, we're looking for the Levi or Levy center or whatever. And the 3 people we stopped, they were students there. They were like, oh, sorry, we don't know where. I'm sorry, we can't help you. We know there's a stadium over there. We could see it's a football field, but she's not playing at the football field. So by the 3rd person, we're like, okay, forget it. Let's just pull up directions to Levy Center or whatever. We had to exit and go down like a block or so to where the gym area,
the gymnasium, or event center.
And so it's a beautiful, beautiful. Oh man, I have pictures. Well, I don't know if you could see, but that's Nilani. She is number 3 for Southern Utah.
When I see her play, she's like a point guard. If you don't follow volleyball, just think of a point guard on there running and making everything happen.
Yeah, she's a freshman that was playing, so it was pretty awesome. Look at it's like I thought it was at the Warrior Stadium. They had the big TV, and the bougie seats across from us because we were in the visitors section. Still nice seats, but across the way is like the home I don't know, home where the home team is. The seats had backs and like they were actual stadium seats.
Look
It
at
was
that.
so nice. I know. So it was really bougie. There was like a couple of PI girls, one Hawaiian and one Samoan that actually the school they go to Santa Clara. They're originally from Hawaii.
Ah,
One of the girls there was Uncle Russ was there, and it was his cousin's daughter, niece. So they stopped to talk to her, and they Nilani's team won. And then after the game, we hung out. It was
University of
so
Southern Utah went
nice.
into Santa Clara and
Yeah.
beat. So was it good? Was it a good match? They go
Yeah. No, it
5.
was really close. It was a really close game. Like the first match, it goes up to 24. Well, it was 30 to 28. So
Wow.
that was a close game. All their games are like that, 24, 22 or something like that. So it was a really good game. Congratulations to our Nalani. Her and her team did a great job. Both teams did a great job, but we was going for Southern Utah. And then the next day, Saturday morning, we took off to Fatasi's second annual Paul Noah Fatasi Fitness Festival. They had a softball tournament, which, by the way, we're going to have a softball team next year.
Are we?
Yeah, we are.
Hmm. What are you going
That's
to play?
SCDC, huh?
Position are you going to play?
I'm not. I'm the manager.
So when you say
I'm the
we, you
manager.
mean
Yeah,
Mo's going to
I'm the
organize a
manager.
team.
But SCDC had a great team. Their coach is and dang it. Larry is and Larry were the coaches. They did a great job. They got there and just played. Hey, Britt. Britt is on from Utah.
Britt off. We're talking about Southern Utah, and
Southern
Utah checks
and
in.
there she goes. And then this is Phil's team that showed up. There was some other teams there too. This is the Violators. They did really good. They played early on. There were other teams there, like the OGs with Samoan Solutions team, which I didn't get a picture of them, but I got them on video. Okay, Britt, you gonna be on our softball team.
Oh, I like it. I like it.
You just volunteered.
We're going to be
I
calling you
know.
at some point.
I know. You just volunteered doing Sam. So there you go. And the kids. And then, so then the next day I was busy. The next
Oh, I'd
day,
get 5-5 to come out and play.
oh, yes. Yes. And
I
Mercedes.
mean, and other of her
Yeah.
friends.
Oh, yeah, we're gonna kick butt. And then I went to Bula Pies. I love me some Bula Pies. They're in Vallejo on Springs Road. Their storefront has opened up. It's so nice. So I'm always in there. They see me once a week. And this was Saturday, but I went in Friday and I said I seen Stino, Lysandra, his wife, who's there in the black and colorful shirt. Stino was there on Friday and I was talking to him, and then Saturday, I was like, "Ooh, I need another pie." So we go in there, and then I go back in there, and I open the door, and then all I hear is screaming because Angie and Fusi are in there pie tasting, and I was like, "Oh my god!" So we
Pie
hung out,
tasting.
yeah,
That sounds like
because of course, Bullet Pies will be at the South Pacific Food Festival, which is happening October 12th.
That's in EPA, right?
In
That's the one in
EPA.
Yeah.
Yes. So all four of us will be there. We're so excited to talk to them. And then I hung out for a little bit. Mo was in the car, and then I go back out.
Call 5.
I know. We took a
sitting in the
picture.
car waiting.
Yeah, we all had our favorites. Like mine is the mince and cheese, mince meat and cheese. That's my favorite. Angie's was the mama's lamb, and I forgot what Fusi
Ooh.
liked the butter chicken. So it was really good to see them. And Alessandra was like, I just asked, I haven't seen Naki. He's like, oh, she was just in here yesterday. How sad is that?
Just wait by the door. You'll
just
see
wait by
Naki.
the door. She'll be there. So yeah, that's the girls. And then we went to in the middle. That's Mo, my baby daddy. And in the middle is Joseph Fatu Nunu. He was in our wedding. He's one of Mo's best friends. He had a retirement party. He retired from Muni, San Francisco Muni. And so he had a party at his house. Oh my God, his house is so beautiful. He has a swimming pool.
Oh, nice.
Huge back area,
Where's he at?
backyard. He's in Antioch.
Oh, nice.
I got to see Adele and Renee Penueta and just a lot of people, Yvonne Palenga and Eva. I got to see all of the Palengas, the Palenga brothers, like Junior, Warner, Warren, and Wally. So they were all there, and I hadn't seen them in a long. I mean, I got to see a lot of people. Danny Lay was there. I hadn't seen in a long, long time. So it was good to see everyone, all the OGs. One of Mo's good friends, Orchid Follow, came in from Las Vegas for the retirement party. Danny Lay came from San Jose, which soon to be Vegas. I mean, people came from out of town for his retirement party. He's just so, so nice.
I love it when people
Um,
show up to
yeah.
celebrate some event. You know what I mean? An
Mhm.
event for a loved one, and then
Yeah.
just people show up. Like,
Yes.
yeah, that's
And
awesome.
Yosef Fatu was with Muni, I think, for 25 years. 25 years, and then he retired. So he usually, everyone calls him either Joe or Junior. He goes, everybody knows him by Junior, Junior Nunu. But when I first met him, like many moons ago, I knew him before I knew Mo. And I said, "Oh, what's your name?" And he said, "Junior." And I said, "What does Junior stand for?" He said, "Yosef Fatu." It's been Yosef Fatu for the last, I want to say, 30 years. So when he hears Yosef Fatu, he knows it's me. He knows
He
it's
thinks he's in
me.
trouble.
So congratulations to him. Then Sunday, I went to the Pacifica Creatives
Content
sesh, where a lot of Pacifica creators came to the Bay Area, Treasure Island. Be For Real podcast flew in from Utah. K Nova and his wife came from Elk Grove. And I was talking to his wife because we see them all the time at the Polynesian Heritage Awards. And I said, "Oh, so when did you get here? How far do you come?" And I thought the Bay Area. She says, "We drive in from Elk Grove. I don't know if you know where that is." Girl, that's past Sacramento.
That's into Sacramento, then back down south.
Right.
Like that's
And
that's
and
further
then
than Sacramento.
she said she felt like they went around the world because they came from Elk Grove, then they had to go drop their kids off at their parents, which is an EPA.
Oh,
And
go
then
all the way
drive
across.
to Treasure Island, which if you know, when you swing back around, it's pretty much the Bay Bridge. So there's tons and tons of pictures of the content sesh. Amazing photographers were there. Manu Media was there. Of course, the living room media. Wiki Media, Mobligated Films. People traveled from Blessed Visuals were there, and he is part of Cisco's team, media team. Tons and tons of people came in. There was a lot of people that donated clothing for the models to wear. Guapole, of course, Mobligated, and tons of other people that I'm sorry, I just can't remember right now, but Be For Real, K Nova, my son-in-law Lai was one of the models. Of course, Siri was one of the models. They did such a great job. This is the second one that they've done, and it just got better. Of course, PBD was a sponsor. We got food, and then they had Butter and Spice had food. I mean, it was just a lot of people donating time because they don't have funding. So if you feel like donating to Pacifica Creatives, please reach out to them. And it's PD, CJ, Mena, Ane, and JP.
From Obligated?
Yes, from Obligated. So it's 5 of them that decided to put this on just for Pacifica Creatives. And it was a really good event. I don't think I have. Oh, and then this is the background is the Bay Bridge, and then Island.
It's in a
Car
lot
Club.
of rap videos. It's in a lot,
Yes.
a lot of. That's the background for a lot of
Yes.
different imagery.
Right, and then Island Flava Car Club. I might have fucked that up, but I'm so sorry. But they were there. They had like 4 cars there, 4 or 5, that they donated their time just so that people can take pictures in it. And
I saw that. I saw different people in the cars, and I thought, wow, that's something, because
Yeah.
those are nice cars. Those are classic
Yes,
cars,
yes.
and they're just letting people climb in and out of them. That's very cool.
Very nice, very nice. So yeah, there was a lot going on. I'm sure I missed some things, but it was a busy fucking weekend. It was a busy weekend. And then Tavita Takai, thank you for tuning in. Nelle, Melinda, Miley, hi Miley, Sam Ripley. Thank you everyone for tuning in. We have our guests coming on in a little bit, so stay tuned after our community services. And then if you know my eyebrow journey, I had the big it was like forever. When did I have those fucked up eyebrows? I'm down that road
Ooh.
again. So I want to say September, August,
Yeah, I'd say
September.
like 4 weeks.
Yeah, I went to go do my eyebrows where I get like I don't know what you call it, but basically
Right
tattooed.
after
Right.
your boyfriend said, "What do you say?" He
Yeah,
was
he
just
goes,
straight
"Oh,
up.
your eyebrows are too dark. Oh, your eyebrows are too light. Oh, your eyebrows are one's up, one's down." So I got tired of that, and it was time consuming. So I got my eyebrows done, and then after the process, when it's all said and done, then you'll see like little blotches or some is darker than the other. Then you go back to get it
Like touched up.
touched up. There you go. So I did that on Wednesday in between meetings. I was like, I only got an hour. Can you do it in an hour? Because I got a meeting at 11. She's like, yeah. So I went and did that. So I'm back to my 4-week process. I was like, I have Josh Totofi on October 16th.
I got things coming
I need
up.
these eyebrows to be done by October 16th. So
Done. Not like,
done,
need to be
done.
touched up.
No peeling, no nothing. So
No pulling your hair down over your.
No one side of my face. You can only see. So there you go. So yeah, that was my week. It was just I'm so busy. I cannot wait for October to get here because then I get a
breather.
break kind of. Yeah.
Get your head above water and take a deep breath.
Yes. So I think that was it. My lovey is playing softball right now. She just scored a touchdown. Girls
flag
now.
football?
Flag football.
Yeah.
Girls now have their own league. It's flag football. It started this year. She's on the football team. She just scored a touchdown.
So you sent me a video. I think it was their first game.
Yeah.
And she caught a pass, and I'm like, well, she's the tallest girl out there, lobbing it up just to a tight end, right?
Yeah.
So that makes sense. And then she ran away from everybody. I was like, dang, she got the footwork going.
It was so funny. I was like, oh, okay, girl. And so she's busy because she has football now, and then basketball season is after this, and then softball season. And so she's pretty busy.
Yeah.
Hi, Mom. My mom is tuned in.
Hi, Auntie.
Hi, Ma.
She got every season. She's got the whole school year filled up.
Yes, she's
from
busy.
winter.
There's no
winter all the way to because softball is a spring sport, right?
Yes.
So all the way to graduation.
All the way to the end of the year.
To the end of the year.
Yeah, till the end of the year. Mom, I sent the money for the fall. I love it. So you should get it.
I beat you on that. Mine went last week.
It's having to gather the money from everybody else is the issue because I'm done with just me sending. We make it a group effort.
Yeah,
just send.
I got the call and was like, oh no, because I don't envy the.
Yeah, fall lovers are crazy, right?
Herding cats thing of trying to gather everything. So I was like, I'm just going to get this out of the way and get it over there.
Yeah, fall lovers are crazy. So you know what I'm talking about. Let's not get started. But
we're going to stay the path.
We're going to stay the path. But how was your week in Disney World?
So I was not supposed to go. I think last week.
I forgot to post my pictures.
Last week we had talked about that I wasn't going to go, and then like last second they just called and said, "Hey, you're going." So there are a bunch of different nights, and you have to dress up different ways. So the one was and I don't have a picture of it, but I do have pictures of the event. I know I'll bring those up here in a second, but so it was a beach night, like you're supposed to wear beach wear. And so I'm like,
which is
it was a luau. Yeah, it's a different, I think people don't want to use the word luau because maybe it's that culture
appropriation.
Yeah, or something. So it was,
they do it anyway.
Yeah. So, and I was like, they're like, whatever you wear to the beach. And then I look at some of the pictures from previous years and people go all out, right? People go all out. And I was like, okay. So I was like, I'm going to wear an EA and an Aloha shirt, right? Oh my gosh. People were like because it
You're
says
the best.
it's
You're
one of
the
the it says
winner.
Talofa Samoa on the EA,
Uh-huh.
and people were like, "Oh, is that like Samoan like The Rock?" Or in some of the younger group was like the Bloodline.
Oh, Lord.
it was it was bad because it was in Orlando. It's the company, so I know I can start throwing some pictures up.
Mhm.
It is there are 2,000 people at
Oh my
this
God.
meeting, and they get
It's
down.
crazy.
They get down. Like I was like, it was a corporate meeting. No, they definitely cut loose, and it was refreshing to see a bunch of people just having a good time and letting loose. So yeah, the EA went over really well. People were asking
Good.
all kinds of questions. One of the nights it was called Gold, Go Gold. And I should have put the picture, but I just wore one of the top to a pair
Mhm.
that's black and gold, and literally gold, not black
Yeah.
and
Oh,
yellow
yeah,
like
yeah,
the
yeah.
Steelers, but it's gold.
Mhm.
And the number 3 guy in the company came over and he was like, I mean, this guy's a chief operating officer. He's like, "What? I love that shirt. I love that shirt. Can we get a picture?" I was like, "Damn!" And people were looking at like, "What's with the shirt?" Like, I don't know. He liked the
Like it.
the Polynesian print, Samoan print, but it was really cool. They did have a Pacific Islander. It's not a club, but it's like an awareness thing, a DEI thing. I did not see. I did not
What does DEI stand for?
diversity, equity,
Diversity, equity.
inclusion, and belonging. I think DEIB. But it was. I did not see another Pacific Islander, and if there were Pacific Islanders there, I didn't. We didn't talk. We didn't run into each other.
You think you're the only PI person?
I'm sure I wasn't out of 2,000 people. I would think that at least there were some other
Are you
Pacific Islanders.
sure?
So there was a guy that I sent you a picture of him. He looks Pacific Islander, and I kept looking at him, and I was like, "Man, he's not asking me like what." Like, and so I finally asked him, and he was half Mexican, half black, I think,
Ah.
and he looks like Chamorro
Oh,
or
nice.
and he goes, "I get that a lot." I asked him if he's Pacific Islander. He said, "I get that a lot." But so one of the things, so I think
Dang.
that is the back of the room, and that's like 1,800 people. It's not even everybody that was there. So that's the scope of the meeting.
Uh-huh.
Um, and so they had Richard Petty was there. Richard Petty, the king of NASCAR, was there. So he's the founder of Legacy Motorsports, and we sponsor one of the cars
Oh,
from his
nice.
team. So Jimmy Johnson was there. I know Jimmy Johnson's a big deal for the NASCAR fans. I was all about like Richard Petty is sitting up
I
there.
have no idea who Richard Petty is.
Richard Petty's like the Michael Jordan of NASCAR. He's like the
Nice.
greatest driver.
I thought when you said Richard Petty, I was thinking of Tom Petty.
Tom Petty.
And I was like, "Oh, cool."
Well, and
I thought he was a blonde.
he was walking by, and I'm just, after working at Tower Records for 10 years, I'm just not starstruck by
Yeah.
anything. So I was kind of like, yeah, that's pretty cool. But
Lenna, girl, we don't know who this man is.
well, I was in the South.
Yay.
And he's a NASCAR hero. So
go ahead.
this was the store manager of the year. It was really beautiful. So the store manager, all the store manager nominees, and this is two brands of 17,000 stores, right? So you've got 17,000 stores out there. All of the store managers are flown in. Them and their spouses are flown in. Their VIP treatment the whole way. So even the ones that didn't win were brought in. They had a room at the resort. Their spouses got to stay. This is the winner of the manager of the year. And what I really liked was she's older, and that's a bad picture, but we sat right behind their table. They flew her husband in, and it was so touching to see how proud he was of his wife being, the manager of the year out of like 17,000 store managers.
That's
so
nice.
That was cool to see. So I was at the expo. I was told by Naki, get as much free stuff as you can get.
Have pictures of my free stuff. Let me know.
And so that picture is me at the expo at the Energizer booth.
Look at the bags.
And that's actually you and Nicole. Nicole was laughing because when I sent it to her, she goes, what's with the bags? And I was like, Naki wants a bunch of stuff. So I'm like, she started laughing. She goes, I hope you fill them up.
Yeah.
So and I filled them up.
Carl goes to his his company meetings, like with the company that he was with before, and he won't pick up the free. He don't give two shits about the free stuff. But me, I'm like, get everything, get
So
everything.
here's the history of it. I made a mistake of grabbing some free stuff when I met you in Seattle when we were going to the Utopia pageant. And I showed up in Seattle with a bag of stuff, and I was like, I don't care. I just threw it away. And you were like, what's this? And after that, she goes, wow. And I go, yeah, I didn't even get they shoved that in my hands.
Yeah.
And since that time in Seattle,
I
she's like,
take
you get everything
everything,
in sight.
everything.
So those are 3 of the 5 bags I filled up.
Okay, let me just show you. So Carl, he shows me this like conference center where there's all these booths, and I should have
There
posted a
was
picture.
hundreds of booths.
And then I go,
All free
oh,
stuff.
that's nice. And he goes, they're all free. And I go, oh, damn. Well, just take what you can fit in your backpack. And he goes, no, they'll ship it to you. And I go, get everything. Get everything. So let me just show you. Look at my stuff. It came in today. This doesn't even do it justice. Like I separated everything.
There's pounds and pounds of stuff.
That box was like a good 15 to 20 pounds. But this is just a sample of what like there was pajama pants, there was tons and tons of soap and I don't know,
food. So
and,
here's the funny thing. They said they would
man.
ship it out. The expo was on Tuesday. They said they'd ship it out Tuesday afternoon or Wednesday morning before dinner, right? I was going to ship it out Wednesday morning because I was tired from lugging all your stuff all over. And I got up to the room and I was like, okay, I'm just going to kill it. I'm just going to sit here until dinner. And then I had gotten you a bunch of bad food and I'm trying to eat good. I ate 2 of the granola bars, and then I was looking at all the M&Ms and stuff, and I was like, nope. I packed it all back in the bags, walked down to where they were shipping it.
But they had like beef jerky, like the
and
full
ship that stuff out of there.
Man,
because if it stayed in the room, I was going to eat way too much of that. So
see those hefty bags? There was 4 boxes of those. See, and 4 box. I mean, there was like boxes and boxes and boxes of stuff. So thank you very much. I love free. For a fee, I could share, but it was good. It was good.
It was fun. Moana thing. It's not really much about Moana. It's just about water.
Right.
It's about how to conserve water and all that kind of stuff. But it was fun.
I love it. It was beautiful.
It was fun. Yeah.
There you go. And we're back, and our guests are tuned in. They're here. Our amazing, fabulous guests
that are doing great things.
They're doing great
things that we believe in.
Great things in the community, and they're saving lives. That's the most important thing. Thank you for tuning in. We have the most handsome ever, who is my sidekick at the step thing that they had at SCDC, Richard So, and Lenna Malia Itulua. Look at me, I hit all the vowels, but Lenna and Richard, I can't even thank you for all the things that you do to save lives across San Francisco. It's like, nobody ever thinks of Hep B until, and even I didn't until we started going to events, and then you guys came on the last time, and now I make sure that I get tested. I made sure that my whole family gets tested. We're going to start with Richard. Richard, tell us a little bit about yourself and about Hep B free.
Yeah, sure. Can you hear me fine?
Yes,
absolutely.
I'm also wondering, I think Stuart is joining us too. He says he's in the backstage area, but I'm not sure if you guys see him. There we go.
Oh, there you go. Hey,
Great.
Stuart.
Hi.
The gang's all here.
Yeah.
We're all here.
So thank you for this time. We really, really appreciate it. And I guess I'll start. My name is Richard So. I'm the executive director of SF Hep B Free. And we are an organization that does hepatitis B and liver cancer awareness all around the Bay Area. But we're really excited to be here today because this year we've done a lot of work trying to reach out to the Pacific Islander community. And I think I'm just looking at my notes today. Since February of 2023, we've done something like 11 at least 11 PI specifically focused events if we include both screenings, educations, and some media efforts as well. And so this is an important disease for all of us in the Asian Pacific Islander community. And we know that Pacific Islanders are often, unfortunately, kind of left as an afterthought for many initiatives. And we really didn't want that to happen because hepatitis B and the liver cancer it causes is actually pretty prevalent in Pacific Islanders in the Pacific Islands, but also in the immigrants who come to the Bay Area.
It's like a silent killer, right? Like if you
Mhm.
don't get tested. Thank you, Richard. Stuart?
So I'm Stuart. I'm the chair of SF Hep B Free. Was one of the founders of SF Hep B Free, and so I've been working in hepatitis in this area for almost 20 years now.
Wow.
So we've made a lot of headways in the 20 years, and I'm really proud to see all the work we're doing. And Richard and Lenna are doing a lot of work, as Richard said, in the PI community and also in our Asian community.
Yes.
What we like to talk about is that it's a health disparity, hepatitis B among Asians and the PI community, right? It affects our community more than the general population. And so this is why we came about. And, if you want to look at, the PI community, there's also a Hep-Free Hawaii, that we helped start. And so they're doing a lot of work in Hawaii for both hepatitis B and C. So we're here to share more information and bring more awareness.
Awesome. Thank you, Stuart. Lenna?
Hi, so my name is Lenna Te'omalia Itulua, and I am the program associate here at SF Hep B Free Bay Area, and I go to all the PI events. I try to, build new partnerships with our local PI churches, organizations, and it's been good so far. We've been doing a lot of work in the San Francisco area, and we're moving out towards Sonoma and into the East Bay. So we're really excited about that. And since I've been on the team, I was able to come up with a program called Under the Mango Tree, which is something that is relevant to our Pacific Islander community. We're trying to bring them in to learn about hepatitis B. And we do that by tea leaf weaving. We make lei, we make haku. And then it's also popular in our Asian communities when we go to self-help. We teach them money lei making with the ribbon, origami paper, and beads. So it's a good way to get people together in one space so they can focus on on hepatitis B, and then we kind of learn from each other, and it generates really good discussion, and we get a lot of good feedback from the program, and we build a lot of friendships that way and other new partnerships. So I'm excited to continue the work, especially in our community. So that's what I do, is just help these guys.
We love it. We love seeing you guys at the events and then people getting educated about Hep B because it's so important. Richard, what got you into this work? Why Hep B?
Yeah, great question. Really, it was a chance opportunity where I learned about the disease and how it affects our community, and then the amount that we can do with relative little investment. And what I mean is, hepatitis B affects it's about 1 in 12 Asian immigrants in the United States, chronic Hep B, which makes you 100 times more likely to get liver cancer. And across the healthcare settings, you were seeing all these Asians and Pacific Islanders in late stage liver disease. Unfortunately, many of them die within 1 year of being diagnosed, where they're already diagnosed with the liver cancer or late stage liver disease. And that's when they find out that they had the hepatitis B virus that caused that liver cancer or liver damage. And by then, it's usually too late. Whereas if you catch the virus much earlier, before it's done damage to your liver, most people live full, healthy lives. And there's been a vaccine available since the late 80s that protects you for life. So, in a lot of ways, unlike many other diseases, we have all the solutions to defeat this problem as long as people know about it. And that's the big problem. Most people who have this virus have no symptoms until it's too late, way later in their lives. So it's transmitted through blood and sex, but most Asian immigrant and Pacific immigrant communities, it's transmitted through mother to child at birth, where the mom, who has no symptoms either, doesn't know she has it. So she accidentally gives it during the birthing process to her children. And those children often have no symptoms until they're in their 40s or 50s, or even later, 60s and 70s. And that's when that hepatitis B virus has destroyed their liver enough to create the cancer or to cause cancer. And then it's too late. So we call it a silent killer. But if we could, reverse time travel, and just get people tested in their 20s and 30s, or even as adolescents, we can catch it early and prevent that from happening. So for me, that's what, after learning about it, right after college, more or less, that's what motivated me to say, hey, we can solve this. And then, talking about the screening and vaccination, both of those are covered under most insurance, Medicaid, Medicare, and commercial insurance. So cost shouldn't be a barrier in most cases. And so we can beat this by just letting people know.
That's so when you talk about something where intercepting or diagnosing something early on is really key to success, are there any markers that you've had or data that you've had? Because obviously Stuart has founded this a long time ago. Are there things that you can point to, or data or markers that you can say, hey, we're beginning to get that go back in the future to the point where we are diagnosing or intercepting it earlier on for the AAPI communities?
I don't have data off the top of my head, but so the reason why I got into this area is that it is the greatest health disparities among our Asian and PI community, bar none. Hepatitis B is the number one cause of liver cancer worldwide. Worldwide, there's some 400 million people who have chronic Hep B. In the United States, there are more chronic Hep B cases than there are HIV cases. Wow. Okay. And then the burden of that, 60% is among the Asian population and PI population. So you say, did we make any inroads into things? I think there's been 4 actually national viral hepatitis action plans put out by HHS, which is unprecedented in the last 10 years, to have that many plans where it's a national thing to go out there and screen. I think Richard's done a lot of work in terms of progressing and advocating and championing for changes in universal screening, which just came out as a recommendation by CDC the last couple of years ago. We've also advocated for legislation with Assemblymember Evan Lowe to do screening in California. And there's new vaccines coming out, or not coming out, but there's a new one, Dynavax, which is just 2 doses, whereas prior to that, we've had 3 doses, a 0, 1, 6 month. What the newer vaccine is 0 and 1 month. A lot of changes have occurred too, in that in California and in the most states, all pregnant women are screened for hepatitis B, which is good. So this way, if they're chronically infected, they can identify the infant, they can be given immunoglobulins and start the Hep B vaccine, and then you just snip it right there. You won't pass it on. What we want to do is screen those who are adults and older adults, because they missed that safety net. In California, all children should be screened and vaccinated for hepatitis B already. So the pediatric population, we don't really take care of because they're already covered. Those who are of childbearing ages, and if they've had a child, they've been screened. Now, they may not have been vaccinated, so it's important to also tell them about getting vaccinated, so it's lifelong protection. It's not like COVID, where it may help or may not help. The hepatitis B has been shown, the vaccine, to be lifelong protection against hepatitis B. And so we focus a lot on immigrant population, whether it's Asians, PI, because those are the ones who are lost in the safety net. And these are, hepatitis is one disease that is not really top of mind for a lot of docs, right? It's not cardio, it's not high blood pressure, it's not lung cancer. And so we want to bring this to the forefront. So a lot of work that we've done is educating not just the community about, hey, go see your doctor and get screened, but it's about reminding physicians to also screen high-risk populations. So we've done a lot of work in that sense in terms of, accessing medical groups and doing newsletters about hepatitis B, especially in May, which is Hepatitis Month. So it's about reminding docs to do the right thing, and it's about the community education and awareness that, hey, you got to champion for yourself. So one thing we stole from HIV is, hey, what's my status? So when they go see the doc, they can ask, what's my status for hepatitis B? And with that, it should trigger to get screened. And once you're screened, you should be vaccinated. If you're chronically infected, then you should have adequate follow-up. So you should see a physician twice a year. You get liver functions tests. And with that, and there's treatment. There's not a cure yet, but there's treatments to where you can lower the viral load so that you won't get liver cancer. And that's what we want to prevent, is death from liver cancer.
I think the the even if there's data that hasn't been stated, when you've been able to get a monolith like HHS to change the way that they're programming and to implement programs that are reaching out to the community, that's huge. I mean, those are big systemic things that are going to reach tens of thousands of the AAPI community. So congratulations on that. I think that Lenna had said earlier that you guys have moved into Sonoma County. That's good to hear, because there's a big AAPI community up there. Is it in your plan to reach out, continue to spread geographically, or are you guys where you think you need to be?
Well, when we first started, we were just San Francisco Hep B free, but now we're actually SF Hep B free Bay Area. So we're, ideally we would like to work in the 9 contiguous counties in the Bay Area.
Nice.
Yeah, I go to Sonoma County area because that's where there's a huge Fijian population that's there. And so wherever there's a huge population of community of, or people that we need to go and screen, then I'll go there. Like if they're in Santa Clara, I'll go there. If they're in San Jose, wherever they're at, because they need to be screened, and we need we need to take care of them and share the awareness, especially for API.
Yeah, I think Naki said it earlier that we love seeing you guys at the events.
Yes.
We go to events and seeing the table and seeing the people and seeing the education and the communication that's going out to the the AAPI communities. It's touching.
Yeah. Can I ask, the Hep B test, is that part of the regular blood when you go do your blood work, or do you have to ask for it?
Yeah. So unfortunately, the short answer is no.
No.
It has what determines what's in your annual physical is like a federal guideline, and they pick that based on how the big burdens and the risks of normal American or average Americans. And since Asian Pacific Islanders make up about 6, maybe 7% of America, it's not. And so people always come up and say, well, I just got my physical and they tested me for everything, right? And I'm like, actually, no, this isn't part of that. So the takeaway here is they need to ask for it, which I understand. Like, how are you going to remember this one thing?
Right.
But please ask for it. I always suggest just shoot an email. We give out this little card that says, take this card to your doctor. So when people come to our event and then go home, they dump out their purse and they're like, oh, right, that Chinese guy yelled at me to get tested for Hep B. So we always tell them to email or text their doctor and say, hey, can I just get this test done? The nice thing, well, the one caveat is, as Stuart said, in 2023, we helped pass legislation in California that supposedly doctors are supposed to offer a Hep B and C test, Hep B and Hep C test in the primary care setting to those at risk. But there's no punishment if they don't do that. And so we don't know how many health systems are actually making that their rule to have their physicians offer that Hep B and C test to patients. So we still say, unfortunately, it's up to you. Go ask your doctor, be your own advocate. and get that test added. And again, for all of you listening who are worried, well, isn't that going to cost me more? The hepatitis B test and vaccine are covered under Medicare, Medicaid, and commercial insurance, particularly for those who are at risk, which include Pacific Islanders and immigrants.
Oh, wow.
Yeah, I think that's a really well put, that disparate health outcomes remain so because the programs are geared towards the majority, right? So if there's a group that's being left out, they're going to be they're continually left out because the programs don't, and this is a good example, the program isn't geared towards a population that has a high percentage of it, right? Because we make up 6% of the population. So the programs aren't going to be geared towards 6%. They're going to be geared towards the majority. So that's a really good point for the listeners, that you can take your health into your own hands, and get the tools that you need. And to Richard's point, it's covered by insurance. So it's not going to be, it shouldn't be anything additionally out of pocket, but it's just an education piece. So that's one of the things when I hear you speak, especially about outcomes and the health outcomes that are, the small percentage of people have a high percentage of bad outcomes. And if we just go along with the system, we're going to continue to have the same results. So I really admire the mission that you guys are on.
Thank you.
And is it, we talk about PIs, Asian, and our AAPI community. Is that who you're focused on in your nonprofit organization? And is it because there's no one doing it for, you know what I mean? Like we have to do it for ourselves.
Yeah, you hit it on the head. There are very, very few hepatitis B organizations nationally at all. To give you some scope, in 2023, we also applied for state to pass legislation for state money to go towards adult hepatitis B, and it was the first ever state funding to go to hepatitis B for adults ever in California, even though we have a population of more than 30% of California is Asian Pacific Islander. And so we simply focus on the Asian PI community because there is no other resources towards it. Now, we also know that the rates of hepatitis B from African immigrants is also very large. And so we've done some small expansion to those communities. Those communities are not as large in the Bay Area, but we don't want to leave folks out. And kind of the all uniting thing is when in last year in 2023, the CDC changed its recommendation to recommend that all adults get screened for hepatitis B at least once in their life. Before that, it was a series of risk factors that physicians had to remember, like, are they born in is the patient born in a country that has high risk for this? Are you born to a parent who's born from one of those countries? Are you someone who is exposed to blood? Are you someone who has risk factors like multiple sex partners and things? And so that was kind of made it more difficult. And so now physicians just can go, are you an adult? Cool, we should test you for that. But we don't know how many physicians have read this new recommendation or are kind of implementing it. And so that's why we still go out there and say, you got to be asking for it, even though it should be an easy thing for physicians. And we know health systems haven't put in an automatic like alert yet. Not many systems have, to have a doctor when you walk in for that 2 minutes, you get to see the real doctor. He looks at the chart and goes, everything good? We got you on your blood pressure test and all that stuff. We would ideally love if there was a little thing that came up that said, get your Hep B test, but that is not the case for most systems.
Yeah, that checklist, the risk factors thing that you went through, I read it on the internet, so it's got to be true. But it's real close to what you said. It was a couple of years ago, and it said the average FaceTime that a patient gets with a doctor is less than 4 minutes.
Wow.
And I think of, my own doctor's appointments, and there's times where I've got to say, okay, hold on a second. I need some more time. And when you've only got a short amount of time with the doctor, and to your point, are they going to go through all those different things? They're simply not going to. Right. So to hear that some things are changing, and to know that that's, those are coming from grassroots community organizations like yourselves, you guys are are making a difference, but I think that it's still a lot of it falls on us as the patient and the community that has disparate health outcomes. There's things that we can do on our own. So I love the education that you guys give.
Also, I'd like to point out, so Richard's also working on another plan, our blueprint plan, which is to get healthcare systems on electronic medical records, because we've all shifted to electronic medical records, no more paper copies. And so develop prompts. So if they can scan your record and they see, hey, there's no Hep B result, it can prompt the medical assistant in the office, because the physician doesn't have to look through and say you need it, right? Then the medical assistant can bring it to the attention of the physician, who can then order it. So these are prompts that we're trying to get developed into these EHRs, so that when you go see your doctor, it can scan and say if there's no Hep B, you screen for Hep B.
I love that. Look at you, Richard.
It's encouraged. These things are, because when I hear that things within the system are moving, I know that even if we don't have the data, things are better, because the system is beginning to move that direction. Obviously, you're not putting your feet up and saying, "Hey, we've arrived. We're leaning in the tape. We're finishing." But are there things in your program? Mine, just looking at getting HHS to change the way that they address program
huge.
would be mine. But are there things that you're most proud of at this point in the organization's accomplishments?
Yeah, I think if you take a big step back, the amount of education we've done in person, talking to your average person who comes up to us at a health fair or at a cultural event, combined with the various sorts of PSAs that we do, everything from Chinese newspaper and radio, Filipino newspaper, PI podcast. We broadcast at a PSA at a Giants game on Chinese Heritage Night. We get on sometimes mainstream television. For the first time in a long time, we were on Cron 4 this year on live television for a tiny segment. You can see many of these clips and stuff on our website if you're curious. And so we feel really proud at the amount of direct education, indirect education, and screening we've done in the community. We haven't done that much screening because, as we've said, we want people to go to their own doctor and get screened, because that's how they can keep getting care. Because if they get screened with us, we can't provide more care to them, because screening is the only thing we can do as the nonprofit, as opposed to their own doctor. But we direct people to those resources. And the other last two major accomplishments recently were the passage of that law that I just said, where primary care doctors are supposed to offer they're mandated to offer the Hep B and C test. We're trying to figure out ways to make sure that happens.
Oh, I'm paying attention on my visits.
Yeah. And then the money that I said for the first time ever went to adult hepatitis B work, and that was $8 million across the state of California, across various different organizations working on adult Hep B around the state. And so slowly but surely, we're having a bigger and bigger footprint. And I think in terms of the next major goals, as you asked, is one, Stuart had listed this blueprint project so that we can get that ping for medical assistants or physicians, so it's easy for them. So they don't have to remember to ask, that there's a prompt that automatically goes, oh, shoot, right, I'm supposed to ask you this. So we're really working with health systems to push that. And the problem is, since they're not dinged or penalized for doing it, it's not a high priority. So that's that number one. And then the number two, you were talking about HHS, is to make it a part of what's covered under insurance for sure. Because right now, although in California, many insurances, like we've said, cover Hep B testing and Hep B vaccination, that's not the case across the United States. And there's a big scientific group of doctors who determine that for every disease, like what is recommended by the US government, kind of. So even though the CDC has recommended it, it's this special group of doctors that look at all the data that say, yes, insurance, you now officially have to cover all these things. And we're working with that group to try to show them data that says, hey, you should make Hep B screening required universally, because if that happens, just like you said, that would instantly, change millions of lives and would hopefully run us out of a job in about 1 or 2 years.
Hopefully, huh?
Lenna, and this is because you're really the conduit of the program in the Pacific Islander community, and you know the difficulties and the challenges that exist in our community to get things moving in certain directions, or to get people to, take control of their healthcare, and also being able to navigate that. Right, it's difficult for a lot of people in the community. How do you feel about the progress that's being made? There's obviously progress being made with the PI community, but how do you feel about it, Lenna? Are you happy with where you're at? You think there's still big strides to be made?
I have to say, Carl, that I'm happy, but I know that there's still a lot of big strides that have to be made in this work, right? And I think what we have to do, what I've been trying to do for SF Hep B Free and our relationship with the PI community, is we're trying to build the trust so we can go in and be, doing this work together, because we can't do it alone. I have to partner with other Pacific Islander orgs so that the community can see, because you know how our community is, right? They're like, well, it's just them. Who else is going to come? But if I have everybody else, then it makes things easier. So like this year, we were able to first time collaborate with SCDC, Amayusos, Fatasi Youth, and we put on the first time ever with SF Hep B Free, the Pacifica Health and Unity Day, which where Richard was doing his champion stepping with Naki and Carl.
No, with Naki, not Carl.
But I couldn't even and then my pride kicked in. I told Lenna, Richard, that when we were stepping, remember, people started dropping off during the class, and then I was stepping right next to Richard. My pride wouldn't let me sit down. 30, not even 15 minutes in, I wanted to go sit down, but Richard was going 100 miles an hour. I was like, dang, his young blood, I'm gonna keep going. I was like, oh, I'm never gonna dance there. I'm never gonna step next to Richard again.
It was funny because
I don't get enough exercise, so I was like, hey, I'm taking advantage I'm here anyway.
Well, I was told to go in the room and recruit people, right? So I went into the room and I'm trying to get people to go in there, and I saw Richard and I was like, hey, this guy doesn't need any exercise. Other people need to get. And he was walking by. I go, where are you going? He goes, I guess I'm going in to step. And I was walking past him to get to other people. And I was like, well, that's good. And then I was laughing because you ended up right next to Naki. And I was like, ooh, she's too stubborn.
That was so good, because I seen people lined up at your table getting information, were you testing people that day?
Yes.
Yeah, there was tons of people. I mean, it was nonstop. And what I loved about that is because our folks don't. That's what I really love about your organization, is that our folks get to see our faces, and then they're comfortable to go ask the questions. They see someone that looks like them, and then they're like, okay, I'll go and check, because they're comfortable going to ask the questions. Or if it was not someone of AAPI descent, they're probably hesitant to walk up to them.
Yeah.
So I love that.
And that means a lot at being in SCDC, right? That's a trusted organization. That's a multi-decade, pillar of the community.
Yeah.
If you're operating, and Lenna's got it right, you guys are doing it right. You're going to the trusted organizations that have a great name, that everybody knows is there for the community, and you're in their building. It doesn't really matter what the table is. If it's set up at SCDC, if it's set up at these organizations, the community is just going to go, oh, okay, it must be good because they're signing off on it. Patsy's not going to have anybody in that building that's not good for the community. So the community knows, hey, if it's a table, you just go ahead and trust it.
Yeah. But I love everywhere you guys go. There's Lenna and Richard. Hep B is here. Everybody always says, oh, Richard and Lenna here. Oh, Hep B is here. So
I know. I feel like Richard is really popular over there.
Very
is
popular.
Yeah.
Very popular.
I'm like, no, Uncle Richard, he's on the other side playing a game. On the other side, But, I have to tell you really quick how that Pacifica Unity Day started. I first planned it with I went to SCDC, and Aisha and I were talking about it, and we were like, wow, how are we going to do this, just us two, right? So I called Christine. I said, Christine, do you guys want to table up me and Aisha's event that we're doing? And she was like, hey sis, we're doing our health day at another area that same day. Why don't you call call Sylvia and ask her if you guys want to combine? So that's how this started.
That's so
Is
awesome.
that it just took like us communicating with one another. And so that's how they want to do it again every year. We want to do it on Mother's Day because I think the making the lei and offering the lei was a popular thing. And then having other groups come in, they enjoyed watching Aisha do her Tahitian.
Yeah.
She was awesome doing her farapu.
But it opens up the conversation,
Yeah.
while you're
Yeah.
weaving, while making lays, it opens up the conversation that people get comfortable and then they start talking and so what does it mean? Oh, so I love that. I really love you guys' this program.
And that's how you get it. That's how you
Mhm.
communicate within the community.
Yeah.
You have trusted organizations and you have a
Yes.
cultural kind of vibe to it. And then the
Yeah.
conversation just happens. You know what I mean? And people come away with that like, wow, they really cared about, my health. And that's and I've seen a lot of organizations not try to kind of shortcut it to, well, we'll just get to the education piece. And the community is kind of like, well, who are you? Like, I mean,
Yeah, why
you might have
should
great
we listen to
information.
you?
Why should we listen?
Right. You're not even sitting next to somebody that I trust. You know what I
Yeah.
mean? You guys are
Okay.
doing
And then of course, and I hate to say it, but there's always in every minority community, there's are you just trying to be a white savior again?
Yeah.
Like,
Yes.
you white people know best, and
Yeah.
and
Oh.
unless they've done some public health stuff, you have that terrible thing where they're like, oh, why aren't you listening to us? We're doctors, we're scientists. You
Yes.
should just listen regardless of what race. And then they have
Right.
the worst part where they're like, oh, minorities just don't listen to us.
Just don't
And
listen.
then, and then there's that addition that makes it worse. There's that worse tension where, minority communities don't trust the establishment, and the establishment thinks that minority communities are incapable of learning or trusting.
Well, it's totally it's not, it is trust. It has a lot to do with trust, but we only trust ourselves because of all the disparities and everything that has
and
gone on with
history.
us.
You can't just,
History, yes.
you can't just come in and say, well, we're not the same people who did tests on your population 20 years ago. Like, you can't just wipe that away.
Yeah,
You gotta build that trust, which is something that Lenna has really helped us do.
yeah.
We are speaking of building some other new things, is that we are doing another health fair. It's called Waves of Wellness, and it's in San Bruno.
Nice.
November 2nd. And so we're partnering with Health Right 360, ours, Asian American Recovery Services, also Essence of Mana, and the Wolverines Rugby Club and San Francisco LDS Youth. So
Nice.
they're allowing us to use the LDS Sneath Lane.
That's a big facility too.
Yeah, facility for free. And we're building that. So far, we've been able to, we have like 22 vendors who've confirmed to
my God.
give free services that day. And so, we're just consistently meeting to try and do the same thing that we did at Pacifica Health and Unity Day.
I love that.
So we're just trying to do that and get more people to come out. And it's basically, it's focused on youth, but also families as well. But I feel like when we met together with Ben Pahulu, who he's like one of the
elders at the
church, at the LDS church, he wanted to gather as many community resources that he could to try and help his youth in the rugby club and in the area that he serves. And so I reached out to Nani, and Nani brought all her people in, and she talked about how they can do things for the youth and all these activities. And then County of San Mateo came in, Pitt, Taulamo for Tongans. So everybody started to come in and say, hey, we're going to provide this, that, and the other. So you'll be getting an email from me shortly.
Oh, awesome.
And you just hit the giants.
Yeah.
Right? I mean, the big names in the PI community, you just nailed them all.
So they're all willing to come out and participate that day. We're trying to make it a really good day, and also get people screened.
Yes.
Umoja Health, I'm waiting for them to reply to me, but they're also going to be there if they can. So
Yeah, that's awesome. We're going to let you guys go back to your families, but can I just say thank you? Thank you for saving lives and for educating not only our community but everyone that you touch everywhere we go. And now, Richard's famous in the PI community all the time because and I go, "Oh, Lenna's going to be is Richard coming?"
I know.
And we say, "Oh, Richard's coming. Is Lenna coming?" So it's awesome to see because but Hep B stays in their brain, you know what I
Right.
mean? So
And that
I
means they
love that.
trust you. I mean,
They
they know
trust
your
you,
name
yes,
and they're
yes.
they're joking and laughing and having a good
Yes.
time and
Yeah.
asking for you. That means that they trust you. So as we get closer, we'll need a flyer
Yeah.
and then
Yes.
we'll need another and some more of your time to talk about the event when we get closer to it.
Yes.
I
Yes.
Yes. Yes.
I do want to share one more story for those of your listeners listening because I think, and it's of a patient advocate, and I'm hoping that's okay, Lena, to share.
Yes.
There's someone who's speaking at our gala as our patient advocate. We always have one person who tells their personal story, and we always applaud their bravery. And it's for the first time we're having a PI speaker. And I just want for everyone who's listening, like all the time we get, but I feel fine. But
Yeah.
like nobody I know seems to have this disease or have died from this.
Mm.
I'll worry about it later, and then there's concerns with whether it's covered by insurance. And so this person's story revolves around her father who was sick already. She's from the Pacific Islands and her father is too. And he was already sick and had all these medical appointments for a long time in his life. And she was away at college. She comes back home to visit and she's taking her dad to a medical appointment. And during the medical appointment, the doctor's talking about his liver health and his lethargy, which means like tiredness and lack of energy. And the person is like, is something wrong with dad? Like, this is something new. And then the doctor is saying, oh yeah, your dad has liver cirrhosis, which is scarring of the liver. It's very serious. It's caused from Hep B. And she's just like, okay, well, what are we going to do about it? And then the doctor turns to the mom with this look that says like, wait, your daughter doesn't know? And the doctor turns to the daughter and says, given your father's other medical conditions, he's not going to be a good candidate for liver transplant. And so the daughter's like, okay, so what do we do? And the doctor says, there's nothing we can do. The damage is done. Maybe if this was years ago, we could have stopped the Hep B from doing damage. And so it was just, palliative care, which is, her father was going to die. And it was only about a year before the father passed away. And
Oh.
so she wanted to share this story because she was like, oh my God, my father had this other serious medical condition for something like 20 years. And how could we have not found this before? If he had gone to the hospital dozens of times for these other conditions, how come nobody tested him for this Hep B? And we don't really know. And that was, probably in the 80s and early 90s where this wasn't something that's tested, especially, doctors would, as we said, would have had to known, oh, this is a Pacific Islander immigrant. We should test him for Hep B, but that didn't happen. And then she goes to find out that of her dad's 7, I think, brothers, half of them had passed away from liver disease or liver
Oh my
cancer.
God.
And so we talk about 1 in 12, or that 2/3 of people who have this virus don't know it. In her family or her dad's family, half of the brothers suffered or passed away from probably Hep B related liver cancer. And then she asks her cousins who no longer have their fathers, hey, what did your dad get tested for Hep B? And they say, actually don't know. We just knew it was liver cirrhosis or liver cancer. And so very, very likely it was caused by Hep B. So now you take a step back and go, oh my God, if a program like ours had been there, that 20 years ago, could they have been tested for Hep B and found it before it became that serious liver damage and saved those 4 lives. Would her cousins still have a dad? Would she still have a dad? And so you got to remember, and her cousins' dads died when the dad was probably in their 40s or 50s, right,
Oh,
Lenna?
wow, that's
Yeah.
young.
We're not talking 60s, 70s. We're talking 40s
Right.
and 50s. And so
Very really.
Young.
time and time again, you just want to share that, like, go get tested. You're not going to feel sick.
Yes.
It's easy. It's easy. Just go schedule it, and then you'll be fine. If you have it, catch it early, get it treated, and you'll be fine. Most people will be fine. And if you don't have it, get vaccinated, and you never have to worry about it. So I just wanted to share that.
Oh
Yeah.
my gosh, that's
She's
awesome.
on our story bank on YouTube. SF Hep B Free, the little interview that we did with
Oh, that's
Richard in
right.
his
So you can
room.
see it on our YouTube.
Yes,
if you like
yes,
to.
we'll definitely go.
Yeah. So, and then another thing that I wanted to share too is that this is the first time that SF Hep B Free will be awarding one of our awards to a PI person, and that's Miss Christine Mawia.
I know. She gave me the date.
So, and I just love it. We're trying to bring, and that this helps to bring awareness to our community, the stories, because it's more relevant for our people, and then also for others that have been like sitting back like, oh my gosh, but yeah, so we're excited this year, and I hope you guys come to the gala as well.
You know it.
Well, I'll be there. The last year was so much fun, and it
Yeah.
was so many people there. It was awesome. I had a great time. Got drunk.
Hey, and for folks listening, it is a public event. You do have to buy a ticket. The tickets are $125. But hey, like, we sometimes have
so
discount
worth
spots,
it.
and it is really worth it. All the money goes to the work we do, and it is free,
It's so much
nice
fun.
food and free booze. So
great food, great booze, great company, great
Lots of prizes.
Yes,
It's one of Naki's favorite nights because I don't drink, so she's
my
got a designated driver.
No, awesome. Thank you so much for the work that you all do. You may not hear all the stories, but the lives that you saved and continue to save is so important. And that's why you guys are getting blessed over and over and over and over again because of the work that you're doing. So we're so grateful and honored that you came on to share everything about the work that you're doing. We will see you at the festival in November.
Gala.
And at the gala.
October. Yeah.
October. Oh, girl, I will be there.
Well, we're going to have a show about it anyway.
Yeah, we're going to have a show about it anyway. But thank you so much. We appreciate all of you and your whole team, everyone. I know you're always welcome back here anytime. God bless you. Thank you. Thank you so much.
Thank you. Thank you, Carl. Thank
good
you.
night. Yeah.
Bye-bye.
Good night, everybody. Thank
Good
you.
night.
Thank you, Lenna.
Bye.
God, they're so awesome.
What a great team.
Great team. The A team.
That's the A team for the Hep B.
Yes, that's the A team. They do a great job every year, and it's getting bigger and bigger. And now I'm starting, I hear more about Hep B conversations because of Lenna
they got
and Richard and
state funding
Stuart.
for the first time. And when he was saying that,
awesome.
that's the first time in California.
That's crazy.
Like, can you think, like, we got in proportion to other states?
Right.
I mean, maybe Hawaii has a bigger
crazy to me.
AAPI community. I mean, I guess Hawaii would be the other state, but I mean, if California just got it, can you imagine how far off states are like Texas or those other ones where there's PIs, right? But if California's just getting there, there's a long ways to go in a lot of other states, I'm sure.
Yeah, they're pretty badass, that team. I love the work that they're doing. And, because of them, I'm more aware of Hep B. And so, go team, go team. So
they're doing it.
They're doing it. Follow them on all social media outlets. Go check out their Facebook page, everything. And then we'll post this interview with links to their website so that you can get more information. And then we'll post the flyer.
I missed a comment by Auntie Evie.
What?
She's making papa.
Oh yeah. So Christine is on. They're gonna give Christine an award. You missed
be there
Hep
for
B
that.
talking about you receiving your award in October, which girl, we gonna be there. So thank you so much for the SF Hep B team. Some of our program was paid for by the Stop the Hate campaign. You can visit CA versus Hate for resources and all the amazing things. Hey, Christine.
Hey, Cree.
Yes. So it's an initiative brought to you by the California Department of Social Services and California State Library to raise awareness and provide support for survivors of hate crime and incidents, any kind of isms. There you go.
Any of the isms.
Any
I
of
get
the
'em all.
isms. Go, 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 go.
Naki doesn't like isms.
Ah, no.
But she's looking forward to that gala.
I'm
And
looking
you
forward
should
to
be
that
too. That is a great, when you think about those, $100 a plate, those kind of things, sometimes you wonder about where the money
But
goes.
it's for a good
This
cause.
is for a good cause.
It's they have raffles, free food.
You get your drink
food,
on.
get
You
your
got,
drink
and
on.
the food is great.
Food
The
is
food
awesome.
is great. I just remember they had the sliders last time, and I was like, I'm only gonna have one at a
Yeah.
time. And I'll have another
It
one.
was so good. But thank you so much to the SF Hep B Bay Area team, Stuart, Lenna, and Richard, Mr. Famous Richard. He's a movie star now.
He is.
Yeah, he's a movie star.
Oh, that's nice.
Yes.
Is Richard here?
Yeah. Is Richard here? All right. When we go, oh, Hep B is here. Did Richard come? I was like, oh, why? Huh? Why?
Huh?
But yeah, thank you to the group. I got this fan with all the freebies that I got from Carl. Cree, I'm going to send you a picture later. Well, I'm going to show it to you tomorrow morning. But we're here every Thursday at 6 p.m. Come back to FICA with us.
Love you all.